Compassionate Care Hospice and St. Francis Medical Center have partnered to provide Delaware with its first hospital-based hospice, a 14-room unit for terminally ill patients and their families.
When St. Francis Hospital first approached all the hospices within the state, each of us came here, had an interview, and Compassionate Care was chosen, and I'm going to probably quote or paraphrase the CEO, Julie, that our mission statements blended, and that's why we were chosen to participate with them in this partnership.
The goal of hospice is to provide humane and compassionate care for people in the last stages of an incurable disease.
The care at St. Francis is provided by a team consisting of a doctor, a nurse, a social worker, and a chaplain. There's meetings held every week to discuss the patient's care. The families can be involved in those meetings if they want. Those levels are available 24 hours a day. If a patient's family comes in and they're not dealing with what's really happening to their loved one, we get some type of intervention here for them. Families are allowed to visit here 24 hours a day. There's a bed in their room where they can sleep, where they, because sometimes they just don't want to leave their loved one. And we've tried to make those accommodations as simple but as friendly as we can.
Compassionate Care Hospice is now leasing what was a previously unoccupied wing for 10 years. The space has been brought to life with all new patient rooms, a kitchen and seating area, a laundry room, and a family room designated to relax and spend time with their loved ones.
Hospice is the only type of health care that's provided for families. Hospice is mandated, as part of their mission, as part of their goal to take care of the bereaved. We have a full-time bereavement counselor. She has an assistant. The social workers are able to do bereavement. So the family's not left once that loved one is no longer with them. People always talk about closure when they lose someone. In my own opinion, I really don't think there's a time when anyone puts closure around losing someone that they love. They learn to adjust to the situation. When holidays come, families will feel that loss. When birthdays come, they'll feel that loss. And then we encourage them to call us. We follow those families for 13 months after the patient dies. They get phone calls from us, they'll get letters from us. If they need someone to talk to, they can give us a phone call, and one of our counselors will talk with them. If we can't meet their need, then we find a community resource that can meet their needs. So they're never left alone.
To arrange a tour or see if someone you know qualifies for care, visit the organization's website at www.cchnet.net or call 302-993-9090.